Hi, my name is Tara Bear, and I'm going to be talking about budgeting and managing fiscal resources. The purpose of budgeting is to allow management to forecast future activities so that the objectives of the organization are coordinated and met. Budgeting also ensures that resources necessary to achieve organizational objectives are available at the appropriate time, and it also helps management control the organization. As we all know, healthcare costs are rising, and reimbursement to the healthcare delivery system is declining. There are three major forces that drive the healthcare delivery system. They are access to care, quality of care, and cost of care. Unfortunately, healthcare is a business, and we as nurses need to become more fiscally savvy. So what exactly is a budget? A budget is a quantitative statement, usually in monetary terms, of the plans and expectations of a defined area over a specified period of time. It provides a foundation for managing and evaluating financial performances, and they also detail how resources such as money, time, and people will be acquired and utilized to support organizational goals within a defined period of time. So let's take a look at the budgeting process. Budgeting is the process of planning and controlling future operations by comparing actual results with planned expectations. The budgeting process involves both planning and controlling future operations. Let's first take a look at the planning aspect. The planning aspect of the budget process includes goals and objectives of both nursing and the organization. Goals and objectives help identify the priorities of the organization, and they also direct the organization's efforts. In order to plan, the organization must know things such as the demographics of the population they serve, sources of revenue, statistical data such as the number of admissions, average daily census, length of stay, patient acuity, and also need to be aware of the wage increases of the market adjustments, costs for new equipment or technologies, staff mix such as RNs, LPNs, PTCAs, and also regulatory and organizational changes. Historically, the past was a common starting point for projecting the future. However, with the ever-changing payment environment, this may not be true and could be one of the drawbacks of the budgeting process. When this is done, oftentimes readjustments during the actual budget period is required. Next is the controlling process, and this is where they compare actual results with the projected results in the budget. The controlling depends on the planning. There are several different types of budgets. The first one is an operating budget, also known as an annual budget, and this monitors the day-to-day activities, resources, personnel, and supplies, usually over a 1-year period. This is also the most relevant to nurses because nurses are working closely with patients and know what is needed to provide quality care on a daily basis. Next is the revenue budget, which is the money organizations receive from patient visits, procedures, and inpatient hospitalizations from Medicare, Medicaid, private insurers, or patients themselves. For nursing units, revenue budgets are based on daily census and length of patient stays. Next would be the expense budget, and this includes salaries and wages of staff including overtime, shift differential, education, holiday time, orientation, and benefits. Non-salary items include medical supplies for patients such as IV tubing and dressing supplies, also pharmacy costs, cost to fix equipment on the unit, and equipment rentals. Next would be the capital budget, and this includes physical renovations, new construction, and new or replacement equipment planned within a specified time period. Usually capital items have an expected performance of 1 year or more, and they exceed a certain monetary amount such as $500 or more. Few nurse managers are asked to prepare capital budgets. So let's take a look at the nurse manager's role when it comes to budgets. Historically, nursing departments comprise the largest percentage of hospital employees and expense. Therefore, nurse managers have a significant responsibility to maintain balance between patient care and cost-effective budgeting. Patient classification systems were adopted in the 1970s for the purpose of understanding the utilization of nursing resources and to allow for an objective measure of the full-time equivalent, or FTE, requirements. They assist in qualifying workload measures for acuity, hours per patient day, and length of stay. They also provide methodology for monitoring variance analysis when meeting goals. The budgeting process begins with the nurse manager, and it usually takes between 3 to 6 months, and they are key to identifying the needed resources for the upcoming budget period. Let's take a look at the timeline for the budget process. As I previously stated, the first level manager starts the budget process. They are key to identifying needed resources for the upcoming budget period. The manager will prepare a first draft of a budget proposal by seeking information from staff about areas of needed improvement. They also review productivity and the need for updated technology and/or supplies. It then goes up to the managerial hierarchy, meaning other managers evaluate the proposal and they make adjustments as needed. And then it goes up the ladder to the executive management, and this is where significant changes usually are made. And then lastly, it's approved by the governing board, and this usually occurs several months before the beginning of the new fiscal year. So how is the budget performance evaluated throughout the year? Two ways: variance analysis and position control. It's most likely that the projected budget will differ than the actual budget. So the variance analysis takes a look at the difference between the budgeted revenue versus the actual revenue. Managers have the responsibility to respond to these variances in a timely fashion. They need to review the activity level and determine the cause for the variance. Next is position control, and this is another tool that's used by managers, and this is used to evaluate the budget process. It compares the actual numbers of employees to the number of budgeted FTEs for the nursing unit. The nurse manager updates the list of employees and their FTEs, such as new hires, resignations, etc., throughout the year. Next, let's take a look at the budgetary performance problems. Let's start with reimbursement problems. First, from insurance company disputes. Insurance companies can dispute hospital stays if they think, for example, a patient could have been discharged sooner and there wasn't good enough documentation to keep them longer. Next would be patient disputes, if a patient is disputing hospital charges and they refuse to pay them, or if patients are unable to obtain needed resources at discharge, such as they have a PICC line for long-term antibiotics and now they're unable to pay for those expensive IV antibiotics or other medications they may need. Other problems come from the staff. Staff can have a huge impact on the budget process by misusing sick time, excessive overtime, or turnover and wasteful use of resources. Here's where it would be important for the manager to explain to the unit their goals, also the organization's financial goals, and how each individual is responsible to help meet those specific goals. So what can we do? Staff definitely needs to be more aware of the cost of the equipment and supplies. By being aware, this will hopefully encourage them not to be wasteful and to be more mindful of how they use resources. Also, we want to make sure that there's adequate staffing. By having adequate staffing, it should help to eliminate overtime, any creep time, and it will help cover vacation and sick days. Also, staff need to be involved in unit and organizational decisions. By being involved, it makes them feel invested in reaching those unit or organization goals, which in turn can help them be more fiscally responsible. So just being more aware, even making small improvements, can make huge differences in the long run. Next, this slide has a video on why the cost of healthcare in the United States is so expensive. I just thought it was interesting kind of to go along with the topic of budgets and fiscal resources. Lastly, this is an article that looks at nursing and hospital costs. It takes a look at who pays for care, the trend in pay for performance, also outcomes, items in the nursing unit budget, and how nurses can help reduce costs. Thank you.